Thank you very much indeed for joining. My name is Sarah Perman. I'm the Director of Public Health for Hertfordshire. We wanted to put on this session to give you an update on the situation with measles across the country, give you a briefing about what that means for Hertfordshire, and to talk to you about the actions that we're taking to try to improve uptake of the MMR vaccination. And really to discuss with you what more we could do to make sure that we're getting messages out to local residents in the right way and making it as easy as possible for local groups and individuals to access the vaccine. I'd like to introduce at this point my colleagues from my team. Geraldine and Aideen, would you like to introduce yourselves?
Geraldine, do you want to go first?
Sure. Hi everybody, I'm Geraldine Bruce, Head of Health Protection at Hertfordshire County Council, and I work with Aideen and Sarah.
And good afternoon, I'm Aideen Dunn. I'm a consultant in public health in the public health team in Hertfordshire.
Thank you very much indeed. And just to say a little bit about our role in public health, we work very closely with the NHS on the treatment of measles, on the delivery of the vaccine, but we play a role in coordinating support across Hertfordshire for communities in making sure that people do have the right information about measles and access to the vaccination. So any of the feedback you give us today, we will be passing that on to other partners that we're working with very closely on the response to the situation with measles. We're going to kick off with a bit of an overview of the situation, and then we'll be inviting discussion and feedback. Janae, you ready to share the slides?
Yeah, sure. Geraldine, can I ask you to keep an eye on the lobby for me while I'm sharing? I won't be able to see it. Is that okay?
Yeah, of course.
Thank you.
Thank you. So an overview of the areas that we're going to cover. We're going to talk about what measles is, the symptoms of measles to be aware of. We'll also explain about the MMR vaccine, give you an indication of what we're seeing with uptake of the vaccine across Hertfordshire, and then importantly come to you to find out what more we can do to work with you to make sure that we've got these messages going out to your communities and service users. Next slide, please. So starting with the basics really, and we do need to start with this because measles, of course, is very rarely seen these days because the vaccine is so effective. So many of us have never seen measles in our lifetime. Measles is an infection that spreads very easily and can cause serious complications in some people, such as young children, pregnant women, and the immunosuppressed. It's a highly infectious disease. Spending just 15 minutes or more in direct contact with someone infected with measles is enough to transmit the virus. And it's usually spread through coughing or sneezing. It takes from 7 to 18 days after exposure for a person to develop infection. And a person is infectious before the onset of the rash, usually from about 4 days before the onset of rash until 4 days after that rash appears. Unfortunately, 1 in 5 cases of measles results in hospitalisation, and we are seeing that level of hospitalisation in some of the outbreaks that are happening at the moment in the West Midlands. And 1 in 15 cases of measles can result in serious complications or, sadly, very rarely can result in death. So the message that we're really trying to promote here is that measles isn't just a rash, it is a serious illness. Next slide, please. So here you've got some photos of what measles can look like and a list of some of the symptoms. So before the rash appears, in those 4 days that usually happen before onset of the rash, the infected person may experience a runny nose, cough, high temperature, itchy red eyes. The rash generally starts behind the ears, spreads to the face, and then onto the trunk, the torso, before moving on to the arms and legs. It may look red and blotchy, but it's not usually itchy, and the rash tends to last for up to 3 to 7 days. An infected person is able to spread the disease 4 days before the rash appears and 4 days afterwards. Now, I mentioned that measles isn't often seen, and although obviously we're seeing increased cases at the moment, so there is a lot of work going on to make sure that clinicians who might not have come across measles before are able to recognise the symptoms and to distinguish between measles and other health conditions which have rashes, such as scarlet fever or a post-viral rash. And you'll see there from those pictures that actually we don't have a very good stock of images which reflect our diverse population. So there is work going on nationally to make sure that GPs, that doctors in any departments have access to what images which indicate what measles looks like on black and brown skin as well as on white skin. Next slide, please. So how to avoid spreading measles? There isn't any treatment for measles. People who are infected can be made comfortable, can be supported, but there's no medicine. So the best way, obviously, to avoid getting measles is by being fully vaccinated. The World Health Organization recommends that at least 95% of children are fully vaccinated, and that means 2 doses of the measles, mumps and rubella vaccine. If vaccination is below this, measles is more likely to spread, and that's what we're seeing at the moment across England. If you think you or someone you're caring for may have measles, and you do need to be seen by a doctor, whether that's at your GP practice or in a hospital, it is important that you call the setting first to let them know that you think you're caring for somebody with measles and that you will be coming in. And that's so that the people working in that clinical environment can provide safe facilities to isolate you or your child when you come in and separate you from people that are waiting to be seen who've got other health conditions, just to minimise that risk of infection. And good hand hygiene can also help avoid spreading measles. Regular hand washing is very important. Trying to cough or sneeze into tissues, putting those tissues in the bin after use, all good practice that we've had during COVID. Next slide, please. So I mentioned the current vaccination levels and the risk. So across England, we are seeing vaccination rates usually below 95%, particularly for that second dose of MMR. And currently our rates in Hertfordshire are lower than 95%. On average, the rate is around 88% for that second vaccine dose, which means that 1 in 5 children are not fully protected against measles. And in some parts of Hertfordshire, the rate for second vaccine falls to as low as 80%. UKHSA has declared a national incident due to the high and rising number of measles cases. The majority of cases and outbreaks that we've been seeing over the last few weeks have been in London and in Birmingham and Solihull. Most of these cases are in children under 10 years who are wholly unvaccinated or have only received 1 dose of MMR. We are also seeing some cases in a slightly older group of young people aged between 18 and 26. There are no outbreaks in Hertfordshire at the moment, but we are seeing more cases in Hertfordshire in January and in early February than we have seen at this time of year in previous years. And that's due to our low vaccination rates. And obviously that could change quite rapidly over the coming months. Next slide, please. So the good news is the MMR vaccine is highly effective. Measles is preventable with the MMR vaccine, and it is free, obviously, on the NHS. The vaccine is given as 2 doses, the first at age 1 and the second at age 3 and 4 months, just before children start school. But the message that we want to promote through the work that we're doing at the moment is that it's never too late to catch up. So, really important that we make sure that our young children are fully immunised, that parents and carers stick to those appointments that they're given. But if a child is older or a young person has not been fully vaccinated when they were younger, it's never too late to get that catch-up vaccine. There are two types of MMR available, Priorix and MMR Vax Pro. If someone is concerned about porcine gelatin in the vaccine, then they can request Priorix, which doesn't contain any pork-based product. And also the MMR vaccine does not contain mercury. Next slide, please. So just some headline information about inequalities on the next two slides. There are inequalities in vaccine uptake across Hertfordshire, and you can look at that by different indicators, including by deprivation, by geography, by ethnicity. And unfortunately, the burden of measles clearly falls disproportionately on some groups where there is low vaccine uptake. So what we're trying to do is address inequalities in vaccine uptake between populations, making sure that we're listening to communities and understanding the reasons why some people haven't been able to take up the vaccine. We put there on the slide just some headline information for Eastern North Herts and Herts Valleys, what is South and West Herts, and that shows where we have some of the lowest uptake among ethnic groups for 2 doses of MMR in our older young people. So that's young people who are aged over 18. And those aged 18 to 26 have the lowest uptake of all age groups across the county. Next slide, please. So if we were look at this by groups, we know that there are some groups, some communities who have lower vaccine uptake rates or who are at risk of low vaccine uptake. And this may be due to a number of reasons, including health beliefs or including difficulties in being able to make appointments or access appointments. And on this slide, you'll see some of the groups that tend to have the lowest uptake rates for MMR. That includes members of the Gypsy, Roma and Traveller community, members of some communities such as Steiner, members of the Haredi Orthodox Jewish communities, people travelling in from countries with higher incidence of measles, where their own vaccination status may not be up to date, looked after children and some groups of young people, children from large families, and I could go on. And obviously there is an overlap between the characteristics of many of these groups, which compounds the difficulty in accessing vaccines. Next slide, please. There is a lot of activity going on across Hertfordshire, preparing for what is likely to be a surge in cases of measles and potentially outbreaks. We are getting communications out to a number of organisations and settings. For example, we've written out to all parents and carers via schools. We've also sent out communications to settings which have residents with health conditions via our colleagues that work in adult social care. We've done a lot of work through the media to get messaging out on social media. We're also working very closely with NHS colleagues to make sure it is easy to access a vaccine. And on this slide, you'll see where there are some pop-up clinics taking place, not next week, the week after. Half term is different in different parts of the country. So the week of the 17th of February, there are pop-up clinics in a number of locations across Hertfordshire, which hopefully means that it's easier for parents and carers or adults to access vaccines. That is in addition to the normal place where you would go to get your MMR vaccine, which is at your GP practice. And the message that we're trying to get out here is please check your child's status for their vaccines. They can do that by looking at the Red Book, or you can also download the NHS app where you will find your child or your own vaccination history. And if you do find that you're lacking one of the MMR vaccines, contact your GP or access one of these pop-up clinics. Many of you, through your groups, your organisations, we worked very closely with during the pandemic, and we know how important that relationship was for making sure that we were working very closely with you to get messages out about COVID, also about the COVID vaccination, listening to what people in your groups were saying, what their fears and concerns were, so that we could make sure the messaging captured that, making sure that we made it easy to access the COVID vaccine. So it's really building on that. We want to work closely with you around this emerging situation with measles. We know from COVID that you play a really important role in helping people to understand the importance of vaccines and being able to take them up. And the key role that we think that you could help with is addressing those 3 C's: confidence in the vaccine, convenience in accessing a vaccine, complacency that people might have about health or ill health or vaccines. Next slide, please. So the value that we believe that you can bring as voluntary and community sector partners is your ability to identify low uptake in local communities. We've got some really good data which gives us a breakdown of vaccine uptake by place, by school, and for some groups, but it's not as comprehensive at all as we would like it to be. The vaccination sort of delivery system is somewhat fragmented across the United Kingdom, and actually been able to pull together a really comprehensive picture by community and by place of vaccination uptake is difficult. So any support that you can give us from your insights into where you believe there are areas, groups with low vaccination uptake would be really, really helpful. And then we want to work very closely with you to understand those root causes of low uptake. We know from all the evidence nationally that actually there's very high trust in the MMR vaccine. That the reason why some children haven't had both doses or adults haven't had both doses, it tends to come down to the practicalities of organising a vaccine. So people with large families, busy lives, not being able to easily make appointments with their GP. So those tend to be the reasons, the practical reasons, rather than any fears about the vaccine. Having said that, we do know for the 18 to 26 age group that when they were eligible at a young age for the vaccine, their parents and carers may have been affected by the type of information that was coming through, which might have led some parents to have concerns about the vaccine. That's all now been discredited. So there is an opportunity to rebuild confidence in that age group in MMR. So number 3 is about us working with you to establish new partnerships, hearing from you about how we can deliver interventions that help people to take up the vaccine more easily. So as you'd have seen in one of the previous slides, we've got pop-up clinics. Is that the right approach? Are we putting those clinics on in the right places? Are they accessible to people in your community who may want to take their children or take themselves in for a vaccine? And then really working with you closely on communication. So there is a whole toolkit of measles communications that's been made available to us from NHS England. Do those materials work for your groups, for your service users? Are they written in the right way? Do they address the kind of issues and questions that people have? Are they in an accessible format, in the right language? Are we getting them out there in the right way? So again, we'd really like to hear from you about the suitability of those communications and whether in some cases a more tailored response might be useful. Next slide, please. So final slide, really. We do need you. So we want to hear from you about the concerns or questions that you're hearing on the ground about measles or about MMR, the barriers that people face. Can you help them? Can we help them? Do you have links into any of those groups that we highlighted in one of the previous slides where we know that there is low vaccine uptake? Can you reach them for us? Could you provide information in specific languages, in accessible formats, using social media in a way that we might not be able to in the council to reach groups. Can you get that message out there to people that you work with or support or come into contact with, that it's never too late? You can book an appointment with your GP practice or use one of the pop-up clinics to access a vaccine. And for people who may need some additional help to access, for example, people who are digitally excluded and can't make appointments or can't drive to clinics, or people with learning disabilities, is there anything that you can do to help those people, or that we can do to help them access the information they need and access vaccines?
There is a lot out there, and there are some video messages from clinicians, etc. There are links to all the various languages, and of course, if there's a language on there that you need that isn't there, then you can also request that via email. So I'll send out the Easy Read leaflet, and I'll also send out the link to the leaflet that comes in various languages, and you can pick according to your community. That would be great.
It's never too late, but the MMR vaccine, not all of us of a certain age were offered it. Some of us, including myself, had measles. So I haven't had the MMR vaccine. I've had measles, and I've got the immunity from measles. So there's no point in me asking for the MMR vaccine. But there is guidance according to your age, and we can make that available perhaps in a follow-up email, because it's a little bit different for different age groups depending on when the MMR vaccine come in.
So generally, those of us kind of born in the 60s would have been exposed to measles, as Sarah said. But of course, if anyone's concerned, the message is checked with your GP, because of course some underlying health conditions could make you more at risk. Immunosuppression, as Sarah mentioned in her slides. So it can be quite individual to that person.
The other thing to say is that you may have been on the end of this yourself, but there are already alerts going out nationally. Reminders are going out to, I think, in the first instance, to parents of children who are not fully vaccinated. And we will be adding to that locally by, not ourselves, but our NHS colleagues will be looking through the records, the vaccination status of patients, and sending out alerts locally. But don't rely on that, and tell your service users not to rely on that, because we know that those systems are not foolproof.
I just wanted to say, I'm doing work within the team to try and reach people that are living on Gypsy Roma traveller sites. We'll be going out to our asylum seeker hotels, but really keen to try and establish links into other communities. So I suppose it's an ask from me around kind of community championing amongst certain maybe religious groups or faith leaders. There's some certain groups that I'd really like to reach into. So I think if anyone can make contact, I know on the slide at the end we're going to give an email address, Sarah, but if anyone thinks that they can reach into any of those communities that are on that list, then do drop me an email, because I'm really interested in going out and supporting this work with you.
Okay, so that's our generic email address. It looks very impersonal, but it's us, and we monitor it regularly. So please use that if you have an ask of us as a team, or a question, or some suggestions. We're really keen to work closely with you. So we'll be really pleased if you can get in touch. We'll send out the slides as promised, and we'll also follow up on those additional suggestions that people have had on the call. Okay, well, thank you very, very much indeed for your time. We do appreciate it. We'll keep in touch. I hope we don't see a massive increase in cases and outbreaks in Hertfordshire. But if we do, I'm sure we will be in touch with you again quite regularly to talk to you about what we can do to make sure we are, properly supporting and protecting people in Hertfordshire. But thank you very, very much indeed for your time today, and look forward to working with you on this. Thanks. Bye.